I want to talk to you today about a proposed solution to eliminate the high cost of defensive medicine by replacing the current medical tort system with a new system that's patterned after workers' compensation, and it's called Patients' Compensation System. First of all, let me give you a little bit about my background, not for resume purposes, just so you understand context and what I bring to the table in looking at this. Currently, Jackson Healthcare provides patient care to over 3 million patients a year with about 1,500 providers, clinical providers, nurses, doctors, CRNAs, and other clinical therapists and so forth. We provide services in every state in the United States, and we have a real understanding. Hospitals mostly are our clients. We also provide software that, and I'm going to steal the logistics guys' saying earlier, but it's called Care Logistics, that runs the operations of the hospital. But before that, for 34 years I've been in healthcare, and I have owned hospitals, the third largest surgery center company in the world, over 200 medical practices, and created a lot of partnership with doctors. I say that for this purpose, and that is that I understand the inside baseball of healthcare and how it actually works. And from all sides, we have people that own hospitals and the doctors and reimbursement and all that kind of stuff. So I only say that to tell you what perspective and kind of how I look at healthcare through that lens. The medical malpractice tort system in the United States is based under 3 main goals: deterrence of unsafe practices, compensation for injured persons, corrective justice. The tort system is not accomplishing these goals. This was written by Sarah Hoffman out of the Annals of Health Law, and she won this in a competition in 2008 for writing this paper. We did a survey of physicians. Now, our perspective, because we've been in healthcare, is that physicians control the expenses of healthcare. Now, Dr. Hill may say, no, they don't, insurance companies do, and so forth. But what I'm talking about is legally. It is illegal to go into a hospital to order a drug, order a test, or any other procedure unless you are a doctor. So they know what the cost and what their practice patterns are. So we did a survey and had Gallup do this survey for us. Doctors reported that 26% of all overall health care costs can be attributed to the practice of defensive medicine. Now, I've been, as I say, I was in our industry for over 30 years. This actually caught me by surprise. Our survey previous to this was 3,000 doctors. Now, Gallup knows what they're doing because they call up people random, over 500. But our 3,000 doctors that we took said up to 34%. I knew it was a problem, but I didn't know it was this big of a problem until about a year or two ago. And the thing that has changed as much as anything is it's now being taught in residency to protect yourself from lawsuits by ordering defensive medicine. This equates to a potential, from what doctors believe, of $650 billion per year. It's a bigger number than anything that's been discussed in Washington in a long time as a potential for savings. Now, let's talk about what is defensive medicine. Let me define it. Now, we're using the definition of the Merriam-Webster that basically says it's the practice of ordering medical tests, procedures, consultation of doubtful clinical value in order to protect the prescribing physician from malpractice suits. Now, we just call it unnecessary medical care for the purpose of protecting yourself against a lawsuit. And this is what we ask doctors. This is our definition. Do you practice it? And so forth. And that's what they said. Now, our solution is focused on solving a different problem than other tort reform has solved. Traditional tort reform has basically focused on what we're calling the tip of the iceberg. The tip of the iceberg is the expenses of litigation. And tort reform, like CAPS and so forth, focuses on solving that problem and has done that. Our focus of the patient compensation system is to solve both. It's not only the cost and the inequity of tort reform, but it's to focus on the iceberg itself, and that's the potential to save billions of dollars each year in unnecessary medical expenses and so forth. Physicians basically are not able to, this is the only country in the world where they have a personal financial liability, and we have found that in tort restore, the best is Texas, without a doubt. They have done more tort reform than anybody in the United States and has done the most aggressive. However, our surveys show that the doctors in Texas practice as much defensive medicine as any other doctor in Georgia or anywhere else where we don't have tort reform. It doesn't solve that, and I'll tell you why here in just a second. We survey 92% of the physicians in the United States are basically practice defensive medicine. We also took the same Gallup survey questionnaire, and please don't tell Gallup I did this, but we used another survey company to call Canada, UK, Sweden, and New Zealand. They practice 0% of defensive medicine. So what's going on here? You probably already know. Well, first of all, let's take a look. Why do physicians practice defensive medicine? And in healthcare, there's a common saying, we don't need to treat the symptom, we need to treat the problem, and this is it. First of all, doctors are absolutely personally, financially reliable, are financially concerned of being risk-averse against jackpot justice. This is the only country in the world that has this issue. Now, other than our service people, policemen and firemen and other service people, armed services, physicians, Dr. Hill, and I don't mean to run his lunch here, but he already knows this. Physicians today can go in and make a mistake and lose every dollar that they have ever earned. That's the mentality that they have to go in today to go to work. And so this is a real issue from that standpoint. And just as important, our surveys have proved that the fact that they abhor defending themselves in a lawsuit. This goes to the very being of their psychic and their self-image and so forth. You know, I was talking to an orthopedic surgeon in Washington at a council, and we were having lunch, and he was telling me, he said, Rick, what you need to understand, this is being taught now. He said, he's a neurosurgeon. He put in an implant in the disc area of a patient, and a screw out of the implant, the device itself, came out. And he said, I got sued. And the attorney asked me, why didn't you do an MRI after you did the procedure to make sure the screw was in there? Well, most physicians will tell you that's not medically necessary. It didn't hurt the patient. They solved the problem. He didn't lose the lawsuit, so forth. But here's the rest of the story. He said, Rick, I have ordered an MRI from now on. He said, it was so traumatic in that deposition to be questioned by a non-physician and me have my name on a $10 million potential litigation issue that I now order an MRI. He said, I have spent personally $10 million since then on unnecessary MRIs in order to solve that problem. This is the environment that we're asking our physicians to work in. So why is it a problem for patients? Well, first of all, obviously, as Dr. Goodman says, they've got a lot of unnecessary tests and procedure, and actually that's more dangerous in order to do that. They're denied necessary care. There are physicians, and again, you're not going to hear this in a cocktail meeting, but among physicians, they'll tell you they're not going to do certain type cases on high-risk patients in high-risk care because they're afraid of getting sued. And so they're denied sometimes necessary care just because of that. Physicians can't afford to admit mistakes. This is ridiculous. I can't say I am sorry for the loss of your baby. I'm sorry I made a mistake. And they can't do it because then their liability will go up and their attorneys are telling them they can't do that and so forth. Of course, this diminishes quality of care and increases the cost of health care, which is bad for everyone. Georgia realizes this is a problem. In fact, we did a survey recently by the Herald Group out of Washington. It said 60% of Georgians believe doctors ordering unnecessary tests to keep from getting sued. Now, these are a random sample of both Democratic and Republican independent that is correlated to this population. In addition to that, 62% of Georgians believe doctors and nurses are under attack from frivolous lawsuits. They despise frivolous lawsuits. I had a urologist that I was talking to Dr. Hill about that got sued. He did a vasectomy. Sure enough, the patient's wife got pregnant. He sued him, 2 years, depositions and all that. And, of course, you probably could figure out other alternatives to what might have happened. And sure enough, it wasn't his baby. But that still took $150,000 for him to go through. It's frivolous, and it just completely, exhausts the system. 91% of Georgians believe that medical malpractice lawsuits drive up the cost of health care, is what our surveys have shown. Patients lose in the current litigation. How do they lose in the current litigation system? Well, first of all, it just drives a wedge between the patient and physician. I mean, in that intimate environment between a patient and a physician, over their shoulder is, how am I going to get sued by doing this, and what's going on? It's going through that filter. And doctors absolutely hate the fact that they feel that way. But it is real. They don't like it, but it is reality, and we're putting them in that position. 80% of legitimate cases never get paid of real malpractice cases. And out of 100% of the premium, only 30% of that is actually getting to the patients. So it's a very inefficient system. Personally, I think this is a very liberal amount based on a recent actuarial study I just received yesterday from Towers Perrin, or Towers Watson now. In Georgia, this is 25%, and then out of that, they pay their attorney's fees out of that. That's the system we have. So they're losing. It's not working. They're paying greater than 50% of their award on legal and administrative costs. And it takes 3 to 5 years to get the money. And to believe it or not, people hate litigation. That's why some of them won't file a lawsuit. Patients will not file a lawsuit if they've got to do a deposition, or it may be good old Doc Jones that delivered 3 of our other babies and family members, and he didn't mean it, and so forth like that. They just don't want to get involved in litigation. The name and blame and shame game is just not a lot of fun for a lot of people. They don't like to do that. This is what a doctor told us. He said, I hate to admit it, but I have to view every patient as a potential plaintiff. I mean, that's just think about that. That's just absolutely ridiculous. So here's our solution that we want to focus on. We think we create a patient compensation system model like the workers' compensation. Give you a quick rundown. Workers' compensation was developed in 1910, and it was on a state-by-state basis. And the problem they were trying to solve was employees wouldn't sue their employer because they're afraid they'd get fired, or their family member may get fired or something like that. And, of course, employers were concerned about these huge jury verdicts and so forth like that. So it wasn't working for anybody, which is kind of similar to what we have now. So they struck a bargain, and every state adopted some form of workers' comp. The employees basically, they withdrew the right to sue their employer. Now, most people don't know this about workers' comp. You cannot sue your company if you get hurt at work based under this law in the United States. The Supreme Court said that's okay. Of most every state, of course, and then the U.S. Supreme Court said that as long as that there's more value by giving up a right to sue, if you have more value created by getting more compensation and it's better for everybody, then they've allowed that constitutionally. Employers now have predictable cost and protection from lawsuits. They are not concerned. They do not lose sleep over my assistant. Can you imagine if my assistant could walk in bring me coffee, spill it, and sue me for $10 million, what that would do to businesses in America today if we had that kind of civil. Well, this is a very good system. The elements of our patient compensation system are this. We first start off with a patient advocate, that when a patient has a problem, they file a claim, and we hope that the doctors and nurses and other people say, look, you may have you may have the ability to file a claim, go ahead and file a claim. Patient advocate walks the person through the system, the patient. Then that goes to an independent, multidisciplinary medical review board. And this medical review board is based under, the reason I say multidisciplinary, if it's happening in a hospital environment, it's not only doctors that are involved, but nurses and other people, because there's a series of events that may have caused the problem. And so you need people that are independent. Independent meaning they don't know anything about the patient, they know nothing about the people involved, and they're specialists, board-certified specialists, and understand the standard of care in their field. They make the judgment, yes or no, is malpractice or not. Then that's delivered to financial people that are in the compensation board, is what we're calling as part of our group. The compensation board is going to use it. We're not designing to pay less than what's being paid to patients now. That's not our focus on a severity basis. If a brain damage case, we took the last 10 years of a brain damage case, and it's $330,000 is the average payment on that. We would suggest, just like in workers' comp, that you take the existing market of what those payments are and start there, and then try to identify what the lost compensation, lost wages, and so forth. So is to try to come up with something fair. Now, this is different than workers' comp. Workers' comp pays for health care and tries to keep you from being destitute. It may be only like 44 weeks is the max, well, 88 weeks if you die of lost wages. And that's to keep people from being destitute. In this case, we're trying to mirror the compensation that's in the current system, but just make it more fair. Then that is ruled over by an administrative law judge, just like in workers' comp. If it's disputed, you go to the law judge. If it's approved, not contested, both the patient and the doctor, hospital, and so forth, nobody disagrees it's malpractice, then it's paid. He confirms it. And then that is referred to an inside quality improvement council, and their focus is to watch every injury and compile the data, ask for people to look at lessons learned, root cause analysis, and tell us what patterns and things that they're doing. And this is all on a confidential basis. Because we cannot name and shame people to increase quality in the United States. And even in national health countries like Canada and Sweden, they know that. To punish people for owning up to their mistakes is not a good environment. And that's what we have. And we think that will increase the quality. This, of course, we believe focuses on quality care because of this quality council giving feedback. Physicians are more eager to share mistakes. Now, like all of us, they have egos. And nobody likes to admit mistakes, but right now they can't afford to admit mistakes. But I will tell you, day after day, we have doctors in our organization that say, Rick, we made a mistake. We should do something about this patient. And they're not going to do that if they're going to be punished and so forth. In other words, that would increase, of course, quality. Physicians focus on Medicare versus worrying about litigation. That should have nothing to do with what you're talking about, the patient talking about the fact that they just got sued and that all those unnecessary tests. And, of course, everybody knows that radiation testing is a real problem, especially when it's not necessary. And, of course, we do create physician accountability. The state licensing board will deal with that, and people will lose their ticket. Now, some criticism of our deal is that, well, if they don't have the ability to lose money or something like that, well, first of all, it's not working now. But second of all, they are still professionally liable, and they can lose their ticket to be able to make an income if they don't improve and don't adjust. Here's the source of funds. We take the existing amount of money right now in the medical profession, the doctors, hospitals, and so forth, buy malpractice insurance, and they would still do the same thing. In our system, they buy from an insurance company or what we're calling the patient trust fund. This is giving to the patient compensation system, and then 80% is going to patients, 20% to administrative costs to run the system. Now, we believe there's absolutely no more new money. We're not raising premiums in our concept. We're just taking existing money flow and we're just redistributing it in a more efficient way that's more fair to patients. We think it's more efficient because right now, less than 20% of the injured patients that would be qualified for malpractice are actually getting any payment. They're only getting 30% of the premium that is out there today, and it takes 3 to 5 years. Under our system, we're saying 100% of injured patients will get paid and take at least 80% of the premium, the same existing premium that's happening today, and we think that that's more fair, more efficient, and we can do that in 180 days, similar to workers' comp. Now, patient benefits, of course, that all patients are heard. Right now, our system denies coverage for the people that need it the most from a litigation standpoint, and that's poor and minorities. It is proving that a lot of people just don't have access. The attorneys cannot afford to take on a $20,000, $50,000, $100,000 case. I don't begrudge them that. That's good business. They can't, put up $50,000 for the possibility of making $70,000, $80,000. So that just denies a lot of people. Under our system, you get heard, whether it's malpractice or not. You get heard. You get faster payments. It's months versus years. There's more compensation to more patients. It reduces patient exposure to unnecessary tests and then, of course, creates better quality through a no-fault system. The U.S. taxpayers benefit, obviously, because if it's entirely financed through the monies provided in the current system right now. It's a reduction of litigation costs because we do have all these judges and all these people clogging up the system, and so it eliminates all of that. It's a reduction of $125 billion in Medicare costs, which is a taxpayer paid event, and $96 billion in Medicaid costs for potential for the help on taxpayers as well. The U.S. system benefits, of course, is the potential to eliminate a lot of unnecessary medicine, up to $650 billion a year, increasing quality of care, encourages adoption of medical innovations. I was the first one to put an MRI in Atlanta near your hospital over on Pill Hill, we call it, in 1980, I think. Today, if an MRI came out, I think it would take several years before a doctor would use it because they would be afraid that it would be called experimental, and something experimental they'd get sued on. And that's the environment we have right now. This encourages the adoption of medical innovation, creates a pathway for other medical cost savings as well, and mainly no cost to the taxpayer. The Georgia benefits are very significant in that we think it's at least $13 billion of health care unnecessary cost, and it's over $1 billion of potential savings in Medicaid that we foot the bill for every year. We'll also attract physicians. In fact, one of the senators asked me, do you think doctors would want to come here? And I said, I've been a recruiter since 1977 of physicians. If I put up an ad that says, come to Georgia, you won't get sued, trust me, there'll be plenty of doctors that will want to move to Georgia, a lot more than they'll go to Texas, in my opinion, even. So it creates an environment and economic growth. This is pro-business. I think we would gain recruiting of other businesses if we had this system involved. So basically, in summary, we believe patient compensation system is a solution to the current ineffective medical tort system. There's a legal precedence from the workers' compensation. It eliminates the high cost of defensive medicine, which we're thinking is at least $650 billion. It's a more efficient use of existing funds. It creates fair compensation to all injured patients, and more patients receive more compensation as well as no cost to taxpayers. When I went to Washington and I heard all of these bending the cost curves issues and so forth, it just amazes me, and I'm amazed if I was a CEO of a public company and I told people we cut expenses by $2 trillion and it was actually only $30 billion, we'd be put in jail. But I want to tell you something. We don't have to wait to bend the cost curve. We have an opportunity right now to absolutely reduce the cost immediately for the betterment for all. Thank you.